Hello friends, let us now learn some important points about surgical blades. Surgical blades are present. We have numbers. Important numbers are number 11 is actually a stab blade which is used for incision and drainage. This is also used for arteriotomy. Okay, then we have number 12 blade which is used for suture removal. Then we have the blades with bellies are mainly used to make incision. The blade with bellies are used to make incision, and number 15 blade is to make precise incisions, whereas number 22 blade is used for incisions for thoracotomy and also for laparotomy. We use this 22 blade is used for thoracotomy and laparotomy. So these are the surgical blades. Okay, this belly, blades with belly is the sharpest portion of the blade. This is sharpest position of the blade. Then how are you going to pass the sharp objects in OT? Sharp objects in OT are passed ideally. They are passed in a kidney tray with pointed ends towards you. It is passed in a kidney tray with pointed ends towards you, that is towards the surgeon. Then how do you make incision? Incision is made from far to near end. Incision is made perpendicular to the skin. Okay, here we use the oblique technique. Is used in making the incision. This oblique technique will cause undermining of edges. Okay, so these are the surgical blades and incision. Thank you for watching.